Psychological safety describes a climate at work where people feel free to bring their full selves to work. They feel free to ask questions, to raise concerns, to admit mistakes, and this is just vital for any work environment like healthcare, where the work is complex, uncertain, a little bit unpredictable, highly customized, so it's important for people to be able to talk to each other openly. I think the most important thing that hospital leaders can do is to frame the work accurately. And by that I mean continually helping people understand that the nature of the work that you do in hospitals is very complex. And there's lots of room for error and risk. And if that message isn't coming through loud and clear from leaders, then people have an implicit assumption that they're supposed to be perfect and everything's supposed to be perfect. So the most important thing leaders can do to make it safe is frame the work for the complexity it is and say things like, I need to hear from you. We need to hear from you. You're the eyes and ears. You're what makes it happen. So framing the work, then modeling humility, modeling curiosity, modeling a sense of awareness of human fallibility, again, helps other people understand that they recognize these challenges. And then I think a third thing is just be accessible. So the primary difference between creating a team and teaming is that a team is, by definition, a bounded group of people who are interdependent in accomplishing some shared goal. Bounded, stable, interdependent, those are the very attributes of a team. A team might be stable for a few days or it might be stable for a few years, but it has a coherence as an entity. In many environments, in healthcare and hospitals in particular, you can't have stable teams. You have 24/7 operations, you have different patients that need different sets of people working together. So what you have instead is teaming. It's the process of communicating, coordinating. It's teamwork on the fly. It's being able to act as if you're a real team when you're not a real team. Well, without effective teaming, teamwork on the fly, patient safety simply isn't possible. So patient safety happens when we have very transparent, very careful, very mindful communication and coordination among roles, among clinicians in all professions.